Hello again, beautiful people, and welcome back to another session of Do It Right with Dr. Ansu. That's me. And today we have something new and different. So far, I've been sharing with you my medical knowledge and my osteopathic skills. Well, today I want to show another DO to you. In my initial video where I was introducing about osteopathic medicine, one of the things I had mentioned was we are everywhere. You can find a DO in almost every field that you go into, and people that you're coming across may be an osteopathic physician and you just never knew it. So today I have a dear friend of mine who I went to medical school with, and he works as a hospitalist, and I just want to introduce him to you guys and just to get to know a little bit more about what he does. So let's get started. Hey everybody, welcome. And right now I have my friend here with me, Dr. Deepak Sharma, who is originally from New York. We went to medical school together. He graduated from Touro College of Osteopathic Medicine. He did his internal medicine residency at Mount Sinai Bronx Hospital, where he rotated between Bronx VA and North Central Bronx Hospital. He did his chief year and then worked at North Central Bronx for another few years before he moved to Geisinger Medical System, where he currently works as a hospitalist. And Dr. Deepak Sharma is also married and is the father of a beautiful little girl, correct?
Yes, that is
And so,
true.
Deepak, I remember you were the baby in medical school for us. So, how is life as a father?
Well, first of all, thanks for having me on. I appreciate the interview, and I've been following your channel. It's really great what you're doing, and I think getting getting the word out there. It's really good for everyone, really, for patients, for med students, aspiring doctors, and physicians as well. It puts a new angle on medicine for a lot of doctors that are not osteopathic physicians. So I think what you're doing is great. So I just want to point that out before we start.
And I'm just so honored to have you here. So I want the audience that is watching this to get to know a little bit more about you. Okay. So why don't you just give us an idea about, what made you want to become a doctor? What was it? Did you have aspirations that led you there, and what got you into Toro?
So, like many people, the straightforward answer is that you want to help people. That's a given. I think any physician has that motive. But for me also, it was the intricate details of the most complex machine known to man, which is the human body, and the physiology and the way pathology introduces itself, and the way these two integrate with one another. I think it's very fascinating. I started enjoying medicine prior to even joining medical school. I did some forums when I was in high school to kind of explore the field, and it was something that was very lucrative to me. I had other interests. I was very good in math and physics, and I could have probably gone into engineering or something else, but medicine really fascinated me, and it's something that started at a very young age for me. So here I am.
Yeah, that's great. And you work as a hospitalist, so tell us what life is like. What do you do, and what is a typical day in the life of a hospitalist like?
So first off, let's rewind back and talk about hospital medicine. What is hospital medicine really? Hospital medicine is an integrative approach to medicine where you accept a patient with a certain problem and you help facilitate them through the hospital stay. Starting from the moment that they come in with their symptoms, you will carefully select the appropriate diagnostic modalities in a cost-effective yet accurate method to diagnose the patient. And then the next step is going to be integrating consultant services or other treatment modalities and procedures to develop a treatment plan and to discuss the risks and benefits with the patient. And the plan carries over at the time of discharge as well, where you communicate that with your colleagues in the outpatient setting, usually through a discharge summary. You may also send an email to them, just letting them know about the events that took place and what to follow up on. So it's basically streamlining that approach from admission, in hospital stay, and then even in the outpatient setting. That being said, the hospitalist lifestyle, there are different ways of looking at it. There are the admitters. So for the admitters, usually it's a 7 to 7 schedule, 7 a.m. to 7 p.m., or you might do like a 9 to 9 schedule, or you might do a swing shift, which I'm on right now, which is a 3 p.m. to 1 a.m. schedule. And all you do is admissions, basically. So you are the receiver. You will catch the patients, you will start up their diagnostic workup, and drop it over to a rounder who's going to see the patient the next day. From a rounder perspective, the typical day is 7 a.m. to 5 p.m. Usually you will come in, you will review the notes from the prior night, you will review the sign outs and see what issues happened overnight to the patient. And you kind of do a triage for your day. So you see which patients are sick, which patients are not. And the sicker patients you will try to see and address first. You'll go through their vitals and labs, and that's how you're going to make that determination, and the overnight events, like I mentioned. After that, you're going to go around on your patients, physically see them one-to-one, hear their complaints, examine them. And then we have what we call IDT rounds after that. In the IDT rounds, you're going to talk to an interdisciplinary team. That's what IDT stands for. And you're going to talk to the social workers, care managers, and develop a plan to discharge the patient, and what things are needed to kind of help coordinate that. Will the patient require a nursing home? Will the patient require outpatient rehab? Will they require anything at home to facilitate their activities, their what we call ADLs, activities of daily living? And that's what the IDT rounds are. Usually those take place around 10 a.m. to 11 a.m. in that time frame, depending on which team you are in the hospital. Then after that, you're just going to act on your plan. So you devise a plan, you act on it, you'll talk to the consultant services, put in your orders. And before you know it, the day is dwindling down to an end, and you just summarize the events of the day in a progress note. And that's your documentation for the day.
So you work both as an admitting team, but also a rounder, depending on your shift. Is that right?
Yes. So I work on a 7 on, 7 off schedule. Whenever we are off, the good thing is we are off. So that's one of the best things about hospital medicine. And when we're on, we can have various different blocks. So admitter is one block, rounder is another block, swing is another block, and then there's the night shifts. They call them the nocturnists.
By the way, I am so thankful that you're here after your swing shift. I really do appreciate that. So I know, Deepak, your wife is a physician. So what is life like with two doctors at home?
It's difficult at times, but it's manageable. Um, like I said, I'm in hospital medicine, and my wife is also in hospital medicine. And the reason why I chose it was also for the schedule that it provides, the 7 on, 7 off. So what my wife and I have recently done is the 7 days that I work, she's off, and the 7 days that she works, I'm off. So we don't need to even get a nanny. We're able to take care of my daughter. I have one right now, so I don't know what's going to happen when I have more kids.
Wait till you have two.
If I have 2 or 3, I think it's definitely going to get more difficult, and I will probably need to hire help. But we have very good family support, which is great as well. Initially, the way we did our schedule was we both were working at the same time, 7 days on, and then during our 7 days off, we would go to New York to my parents. And during our 7 days on, we would actually leave our baby with my mom and dad, and grandparents are very happy with that decision. So they enjoyed her childhood. We enjoyed her childhood because the 7 days we had off were dedicated to her.
Mm-hmm.
And I think we were able to work around it. And it's definitely great.
That's great. I have one more question to ask. You and I, we almost did a video in medical school, a dance video for a competition.
Yes.
Are you still into Bollywood?
Oh yes, yes. I am still into Bollywood. Unfortunately, due to COVID, things have really died down in both Hollywood and Bollywood. The movie industry really took a hit. But yeah, we do watch Bollywood movies. We watch them on Netflix now because there are a lot of Netflix originals coming out. I am still a diehard Bollywood fan,
I love
and
it.
I'm gonna make sure my daughter is too.
Good, good. I know we're raising the next generation. We have to.
Of course.
Can you tell us, what are some of the diagnoses that you see, more commonly, or even something that was really interesting that stood out to you as a hospitalist?
Well, you see the bread butter cases, which are congestive heart failure, COPD exacerbations, asthma, and then you'll see some of the infectious diseases like influenza, which, by the way, we haven't seen this year because everybody is masking, and this is it's amazing. You see how effective these things are.
No, last year, I remember around this time, we were seeing about 6 or 7 cases daily, and we,
Right.
knock on wood, none yet so far. So thank
I
God.
haven't seen any. There are some colleagues that have seen influenza cases, but it is so rare. And I'm pretty sure everyone is going to hear about it at the end of the season, which we're approaching in March, April time.
Right.
So I'm sure there will be data out that this has been a phenomenal year, and you don't see any influenza. Obviously, COVID is a completely different spectrum.
And you're taking care of COVID patients also, correct?
Yes, we are taking care of COVID patients. I'm in Pennsylvania right now. When the initial wave happened back in March, April of 2020, we did see COVID patients here. It was not that major. Like New York was really hit hard. We were lucky enough not to get hit in Pennsylvania, in Danville, where I am. But now the wave that came through was very, very hard on us. And we were at a point where we needed outside moonlighters coming in to help out. There were an additional 4 or 5 teams that were made. All teams are now seeing COVID patients. Admitters are seeing COVID patients. Initially, we were trying to streamline it so there were less exposures and only a few doctors saw COVID patients. But now everybody is seeing them because it's just so rampant in our area. We have over 120 patients that are COVID positive in the hospital at this moment.
120, you said?
Yeah, at this moment. So.
Well, thank you for taking care of them. We really appreciate that. So now that we have an idea of, what life is like for you, let's go back to medical school where it all started, right? So do you feel like medical school prepared you for residency and life after residency? If you could think back to your days of medical school, that seems like so long ago. What was it like? What was the good parts, the bad parts about it?
Medical school is a lot of book knowledge and exams. It is an integral part in becoming a physician, but it is not the biggest part. When you actually start seeing patients, it's very different. You start having a different approach. And a lot of physicians say that medicine is an art. How you talk to your patients really matters. You have to realize that your patients are very anxious, right? And when you talk to them, you need to convey a sense of calm. And you have to show them some confidence that you know what you're doing. So these are things that we did see in the latter part of our medical school training where we did clinical rotations, but it was kind of an introduction to that. Medical school did prepare us significantly for the medical knowledge that we were going to face, but the actual application is something that we learn more so in residency, I feel, than in med school per se. Sometimes things are not by the book. You may have multiple diagnoses intertwined into one patient with varying comorbidities of other issues that they may have. And these complexities are what make medicine very interesting because not everyone has the same treatment regimen. And that's something you see more in residency than you do in med school. So yes, I definitely think med school trained us to pick out the diagnoses and to act on them. But at the same time, the training does have to continue with the clinical rotations and then afterwards the residency, where you really apply those principles that you learn.
And do you use osteopathic skills in your resident or in your work field right now?
So I did an ACGME residency where we didn't do any osteopathic manipulative medicine. I think it's a very good tool to have. I wish I had kept some of that as well. I think it's an added tool in your arsenal of things that a physician does. And that's what makes an osteopathic physician, I think, a phenomenal doctor. You have something that is non-pharmacologic that you can use to help treat patients. I haven't used it on patients per se for liability reasons as well. That's a big issue because I haven't really trained much in it. But I have used a little bit of OMM in my family. And I know you did a segment recently on sinus massages and techniques, and those really do help when you have, when you have sinus infections. And then also for headaches, I've done things on my family, some techniques, and um, they're very useful. But I don't apply them, unfortunately, in medicine. I wish I could, but I don't because I haven't really been trained in the application perspective.
So, a lot of the people who are watching this are probably future medical students who
Mhm.
are probably wondering MD versus DO, right? And that's a question that we went through when we were applying, and people still think about it. As a practicing osteopathic physician now, years later, what would your advice be to them, as they're wondering about this?
So there is no significant difference between the two. The one difference is that osteopathic physicians use the OMT or OMM techniques, and that I think does give an edge from a billable perspective. In the outpatient setting, you can bill for these things as well. And by the way, that's one realm that we don't learn about at all in med school, billing. That's something that I think I still don't know much about because I'm working in the hospitalist setting. We just kind of put in our diagnoses, and sometimes the CDI people get back to us, clinical documentation inquiries, and they ask us, hey, can you elaborate on this diagnosis? Can you change this or that? The billing perspective, we don't know much about. But going back to OMM versus, osteopathic versus allopathic schools, there isn't much of an application difference. Many people do ACGME residencies after completing DO school like I did, and I think you did as well. So I don't think there's much of a difference.
I think one of the things I've heard from a lot of students is they're worried that they may not necessarily get a good residency if they go to an osteopathic school. What was your process like, applying for residency? Did you feel like it was difficult for you? Did you feel like you were prepared going in?
I felt prepared going in, and I think most of our colleagues that graduated from Toro also matched in the first try.
Mhm.
You can apply to ACGME residencies and to osteopathic residencies. I think you have more opportunities in that sense because you can go into both. And now the way the merger is happening with the ACGME accredited programs, with the osteopathic programs, they're kind of allowing both sides to go back and forth.
Mhm.
I don't think there's an issue getting a residency. That fear shouldn't be there. As a matter of fact, I think people that are coming from abroad, they have a little bit more of a difficulty getting residencies, and it's more of a challenge. But as an osteopathic physician, I don't think I had much of a challenge, and neither did our colleagues.
What made you go into your particular field of interest? Did you always know you wanted to do hospital medicine? Was there something that happened during medical school that really stood out for you? What led you where you are today?
I was always switching back and forth. Sometimes I wanted to do surgery, sometimes I wanted to do hospital medicine, sometimes I wanted to do ER. So one of the things that really I think geared me towards hospital medicine is the schedule.
Mhm.
And some of the other fields that I was highly considering were emergency medicine as well, and critical care.
Mm.
All for the same reason. The number of shifts in the month usually is about 14 to 16 shifts a month, and you work half the year basically. So it's very nice, I think, to have that kind of work life where you work hard when you're at work and you play hard when you're off. You can also use that off time for your family. You can use it for extracurriculars. You can use it for other types of ventures. Recently, I've been looking into the stock market, into real estate, things like that. So you can broaden your horizons outside of medicine. And just because you're a physician doesn't make you only a physician. You have a lot of time to do other things as well. And I think this goes for any profession, really. When you select a profession, it doesn't mean you're stuck to it. Sometimes you think out of the box. You may do things with your profession like you're doing, and a lot of YouTubers are doing, like, these days. I think you can really broaden your scope and application of your knowledge and of your skill set. Or you could even build new skill sets, like going into finance and all. So doctors are doing restaurants or other things too. So it's a lot. Life is not just isolated that you're a physician. That's all you do. You don't define your role as just one.
So I would take from what you're saying that you would say you have a pretty good work-life balance then, right?
Yeah, so the work-life balance is amazing, and that's actually one of the reasons why I did choose hospital medicine and why I was considering ER and ICU,
Mhm.
critical care as well. Um, I just thought that once I completed my internal medicine training, I felt very comfortable, and sometimes you get that way where you're comfortable now, you don't want to keep going further. And I think I reached that point. I got married at that point, and then I had our beautiful baby. And I think uh, at that point I decided that I'll just continue with hospital medicine for now, and maybe later in life I may decide to specialize in something like critical care.
Oh, very cool. Um, do you, looking back almost 10 years after graduation from medical school, is there anything you would say that you regret, or, is there anything that would you have changed anything? Let me put it that way. Are you happy where you are? If you could go back and change something, is there any such thing?
So I was the first physician in my family. My sister was a very close second. We both actually went through med school together. One of the things that we kind of struggled to learn was the way of studying in med school. I think I would change my approach to how I was looking at exams. Like, we were always fixated on, like, God, just help me pass. God, just help me pass. And I think you're so fixated in med school on exams because they happen so frequently. It's so intensive. The reason for those exams are not so much just to bog you down stress wise, but they're also to test your knowledge to make sure that you're really up to speed and with what you need to know. It's not just about reading a textbook. It's more about knowing what the key concepts are, why you do certain things, and knowing how to manage. And I think that is something that I would change in terms of my approach, my study approach. Because when I went into med school, my study approach was different. When I came out, it was very different.
Mhm. And I think experience matters, right? It kind of creates these. When
That's
you're in
true.
med school, you just want to get that good grade and pass.
That's true.
Um, Uh, so we're gonna wrap this up, but would you say there's anything, as Dr. Deepak Sharma, D.O., that you would want to share with future generation of potential medical students? Any pearls of wisdom, anything that you've learned over time, as either a medical student or even as a practicing physician, that you think a younger Deepak would have wanted to hear from a doctor when you were approaching this?
uh, Don't be discouraged. You will have failures in life. You will have obstacles in life. You will go through many ups and downs. Right now, I think I have a good work-life balance. In med school, I did not. You only study, you only work hard, and at times you feel like there's no end to this tunnel.
Mm-hmm.
There is an end. It's just a very long road. It is definitely a very long road, but there are rewards at the end. You go in for a positive reason, and that's why they say that if you really go into medicine if you're interested in it, because you need to be dedicated to it, and it will have its ups and downs, but get through it. There is an end, and well, let me rephrase that. There is never an end, actually. That's one of the beauties of medicine as well. There's new data coming out all the time. There's new procedures, new diagnoses, like COVID came out of the blue. Things will come up, and you have to keep abreast on all the knowledge that that is adding to your arsenal, basically from what you've learned in med school and residency. In that sense, the road never ends, but there is always light at the end of the tunnel. So you will have a better work-life balance later down the line. You will be rewarded for that, and just seeing the positive reinforcement from patients, it's very satisfying. You will see different types of patients, but everybody's going through their struggles in different ways, and sometimes it gets thrown on physicians, but at the end of the day, you do get that real rewarding feeling when a patient tells you, doctor, like, thank you for all that you've done. You've changed my life. You've made it so much better. And it's not just the physician, it's not just the patient, it's also their family members that thank you. And I think that really does put a positive spin to medicine, and that's what we're here for.
Absolutely. Thank you so much, Deepak. It was really valuable. It was just so good talking to you and hearing from you.
Thank
And
you.
I'm sure it's going to be very beneficial to some of the people who are listening to this. So thank you so
Thank you.
much.
Thanks for having me.
Of course.